Dear participants, dear friends from all over the world, it's a great pleasure to see you again. And now you know all the small rules that we've set in place for our webinars. And as usual, during the presentation, you will have many opportunities to ask questions, make comments, and please do not hesitate to prepare in advance your questions, and you can put them in the chat box. We will have a 45-minute presentation, then a small break, then we'll open the question answer session. Today we are privileged. We are very lucky to have with us today for the session Madam Rebecka Lundgren from the University of California, San Diego in the United States of America. We are pleased to have you, Rebecka, with us, and the presentation will be dedicated to the evaluation of the Choices, Voices, Promises program that Brad presented during the last session, and I guess you remember that. Rebecka conducted the evaluation of the program, and she will share with us some of the findings. Please, Rebecka, we are delighted to have you with us, and please, you can start by introducing yourself properly. Thank you.
Thank you very much. I'm really excited to be here with you, especially looking at all of the places you come from. So I'm not sure I've ever spoken to such a diverse audience. So good morning, good afternoon to all of you. So as y'all said, I'm going to follow up on the presentation that Brad gave and talk about what results we saw with the Choices, Voices, and Promises implementation study that we conducted several years ago. When I conducted the work, I was working with the Institute for Reproductive Health at Georgetown University. Today, I now work for another university. I just recently moved to the University of California in San Diego at the Center on Gender Equity and Health. So let's see, I have been working in adolescence and mostly in the area of sexual and reproductive health for about 30 years now. And I was very privileged to be the partner with Save the Children to first evaluate Choices, which was the standalone kind of curriculum for young adolescents. And then I worked with them on this study, which looked at choices together with other elements. And I'm still working them to actually this week even. We are working on the fourth resource in that suite of materials, which is called Commitments. It's for teachers. And I'll tell you a little bit about that maybe at the end of the presentation if we have time. So I'm a medical anthropologist, and my research is always, basically done in partnership with governments and NGOs to guide program implementation. So I also have worked with Save the Children. After we had these promising results, we did some workshops to bring together their country offices to plan for adaptation and scale up of the suite of materials. And I think what's very exciting about this program is that it did show to be effective, but it's also proven to be very feasible to adapt and scale and spread to new contexts. So today, what we're going to discuss, I'll start out explaining the study design and the methods. Then I'll talk to you about the results. We'll talk about the qualitative and the quantitative results. Then some reflections on what we learned, and a little bit of discussion about what comes next. So do please feel free to drop questions in the chat box. If you need clarification, if you would want me to stop and explain something more fully, I can do that then, and I think Yao is going to help me monitor that, or we can do it at the end. So this is really, time for you to learn about our experiences. So please feel free to speak up whenever. So I want to start by just reminding you a little bit of what Brad shared with you. So we're looking at the very interesting approach for gender norms transformation and formation at different levels of the ecological system. So Choices was developed for girls and boys. I evaluated that first on its own. It was proven to be quite effective and with multiple different methods, qualitative and quantitative. Then Save the Children developed Promises, which is the community level piece of this, and then Voices, the family level. So today, what I'm going to talk to you about is the evaluation of all three, but most importantly, what we were trying to understand is, what is the benefit of working not only with girls and boys, but also with the family and the community. So one slightly complicating factor is that voices and promises had not been evaluated on their own when we did this study. So there was rigorous evaluation of choices, but not of the other two. So this study had a couple different purposes. We were trying to understand their effectiveness, but also answer a broader question about where to intervene in the ecological system. So I'll start talking a little bit about the study design and methods. So here you see the purpose of the study. So our purpose was, and the reason that we were provided funds, was to evaluate a multi-level intervention to determine whether there are additional benefits of working with the family and the community beyond working with the children, because we had already tested the piece about working with the children previously. Our research question was really looking at changes in attitudes, norms, and behavior. So all of our results fall into those areas: people's individual attitudes, social expectations or norms, and what the young people and their parents actually did, the behavior. So we're looking at changes in those three areas among the early adolescents who participated in choices, and how those were different from those who participated in choices and whose parents and communities also were exposed to voices and promises. So our hypothesis was that these changes would be greater when you engage the entire community, in addition to just the children themselves. Excuse me. So there's a challenge to testing that question, because it means that you have to have very good measures at all levels, for the parents and for the children. And you also have to have pretty strong implementation. And I think you learned a little bit from Brad that we did have some pretty severe implementation challenges in Nepal because of the earthquake that happened during the study. It actually happened while Brad and I were there training the interviewers. So the other thing that's important to know is look at sort of the theory that underpins our hypothesis and this program. So we were proposing that there's 5 interlocking domains that you see here on this bridge. So we have gender equitable education, delayed marriage, gender equitable aspirations, division of chores in the household, and supportive relationships. And those 5 domains working together were all influenced by gender and gender schema. And if we were able to bring about change in all of those by catalyzing critical reflection of gender norms among children, their parents, and their community, that we could then transform or form more equitable gender attitudes and norms that would result in synergies that would help provide a bridge from early adolescence to kind of healthy, productive adulthood. So for a researcher, that's a big challenge, because we were trying to develop very strong measures in each of those 5 areas for children and for parents. So when I'll be presenting the results, and you'll see a lot of it has to do with what measures worked well. So for example, we did not have very strong measures for adults. Our measures for children were stronger. And some areas, the measures didn't hold up very well. So I'll talk about that more as we go along the presentation. So this slide really lays the foundation for what I'm going to share today. This is the study methodology. So the first thing that's important to remember is that we have it's called a 2-armed study. We have a group of communities in the experimental group and a group in the control group. So those children and families in the control group only receive choices. Those in the experimental group received choices also, but also received voices and promises. So when we talk about the control group, that's choices only. and the experimental group is all 3 components. So we started at baseline. So we conducted surveys with girls and boys and their parents in both the experimental and the control group. So you'll see it was a fairly large sample. We interviewed 900 individuals in both groups, 300 boys, 300 girls, and 300 of their parents. So that took place in 2015. Then we had the intervention, which was really quite short, given funding constraints, the earthquake. Of course, we were very delayed in getting the project off the ground. So another notable thing about this intervention is it is what I would call rather light, meaning that it didn't take a lot of time. It didn't run in the community. Usually you let things go for a year, a couple of years before you evaluate. And it was pretty lean in terms of what people on the ground were doing, which to me suggests that if you, for example, had a whole year of intervention, your results could be a lot more stronger. So then we went, a little bit less than about a year later, and we did the inline. So we had focus groups with parents. We had in-depth interviews with children, and we did those in both experimental and control. And then we had surveys, the inline survey in both groups. So I'll be presenting a comparison of the results from baseline to the inline, and then what we call controlling for changes between the experimental and the control, meaning that we might see improvements from baseline to inline in both groups. So then it could be due to choices, or it could be due to other contextual factors that are improving things or making things worse. So I'll explain that a bit more as we go forward. So this, you may have seen this slide before. So this shows the district where choices was tested in Kapavatsu. It is, a region in the Terai bordering India. You can see where the earthquake took place and where Kathmandu is. So this slide here shows where we actually implemented the intervention. So we were in the geographic area, kind of administrative area in Nepal is called Village Development Committees. So we implemented in 4 village development committees. They were selected to represent 36 child clubs, and they were matched. So we chose communities. So we have the control group here in black, the experimental group here in red. So to remind us, the control group only received choices. The red group, it achieved all 3 elements of the program. And we matched these communities so that they were similar in terms of geographic access, roads, etc., ethnicity, but it didn't come out exactly matched. You always do the best you can. So that's where the study took place. And then this slide is just kind of sort of reiterating my comment about measures. So we knew that we would need high quality measures in each of these domains. And we focused quite a bit on the measures with the adolescents. That's something that I'm really interested in and trying to find ways of evaluating programs for 10 to 14-year-olds that are participatory, but child appropriate, but still rigorous. Okay, so let's see. So the qualitative methods, these were to provide insights into participation in the program, and also just to better understand kind of the role of parents in children's lives. And we use the results both to what we call triangulate the results. So we wanted to see, we're seeing these quantitative numbers, numeric results, but how do we interpret them? What do we think they mean? So we use the qualitative data to do that, and also to provide us a little deeper understanding of the role that parents play in children's lives related to these things. So we had in-depth interviews with both boys and girls. We had 15 interviews in the control group and 15 in the intervention group. And we chose children who had participated in at least 5 out of the 9 sessions and whose parents had come to at least 1 session. For the quantitative data, the survey data that I'll show you, everyone was interviewed who were in that community. But in this part, we wanted people who had participated in the program so we could ask them specifically about it. Then we did the focus group discussions with parents in control and experimental areas. And some of the methods, so for the focus groups, we tried to develop an enabling environment. We used participatory techniques with the parents, things like vignettes. So we told stories. We asked them to respond to the stories. We showed pictures, asked them to discuss what they were seeing in the pictures. So we were both trying to engage the parents and also trying to avoid bias. They clearly understood what we were trying to achieve, that it was about gender equality and, ending child marriage. So we were looking for methods that wouldn't be so prone to just the participants saying, yes, yes, we've changed. So similarly, with the children who we interviewed with the in-depth interviews, we use small dolls, as you can see there in the left-hand picture, and the right-hand side are our little emotion pictures. So what we had is we had a family of dolls, so the sister, the brother, and their parents and grandparents. During the interview, we gave them to the children to sort of act out the role plays that we were setting out for them and have them reflect on these situations and how that might be true or not in their personal experience. So we also, the children were relatively shy in the setting, not really verbal. So we also used pictures like you see in the right so they could point to how they felt. So, if you were in this situation, they're acting out the situation. How do you think the sister felt? And so we kind of used props to help them, to get them to be more engaged and comfortable in the discussion. Yeah, so it's important with children because, they may not be very literate, so you might now want to use written materials. You want to develop trust with them. And some of these concepts are a little bit abstract, so we try to make them more concrete with stories and role plays. So just before I move on to the results, a few of our learnings on the methods. So we've developed a new scale as part of this that was really good results, meaning that all of the questions in the scale hung together. And this is now an important measure we can use in other studies, and other studies have used it since. We also mixed methods. We use qualitative and quantitative methods to try to get an insight into some of the complexity of this change process that we were trying to learn about. We did learn about, as you'll see, the multi-component intervention, but it would have been helpful to have additional arms so that we could actually understand the effect of voices versus the effect of promises. So as you'll see, we can't tease out the effect of those two different interventions for the parents and the community. So we're really making a comparison between children only versus parents and community, rather than the two separate. So with those lessons, I can move on and talk a little bit about the qualitative results. So let's talk about what we learned from the girls. So the girls feel that their lives are more difficult than their brothers, but they did note that life is becoming more equitable. So you can see a couple of quotes here, giving girls time to study and work for boys. This is from she's saying this is what her family would say. Don't do that. Boys are valuable in society. Thus, the girl needs to work while the boy studies. But then, she goes on to say it's different in my family. In other families, sister does most of the work and the brother goes out for a walk. He doesn't help his sister with the housework. So that's a little bit of a glimpse into how girls, see roles shared in the household and the priority that boys are given. So the other exciting result we found was that, there is increased agency among girls. They're finding their voices, so a few quotes here. Before I couldn't express myself, but after participating in choices, I can talk openly without any fear. And then another girl talking about how her parents started talking about her marriage when she was young, but now she's 14 and she says she will not marry until after completion of her education and her goals, and her parents have said that's okay. So really, to me, one of the most interesting parts of the study were listening to the parents. We typically, when we work with adolescents, we typically pay a lot of attention to their voices and rarely look at things from the parents' point of view. So what we learned from the parents was that the world is changing and they are struggling with their role as parents in this new world. That the way they were brought up is very different from the way they need to bring up their children. So we have a quote here from a father who says, "My wife has never been to school. My elder daughter says her sister should not get married until she is 21. I like her thinking a lot. When she said this to her mother, she, meaning her mother, was a bit hurt. But I told my wife that society has changed and there are a lot of positive changes. Our daughter is saying a good thing." So you start to see that kind of intergenerational shifts between expectations and roles, which parents need support to manage. So the other strong finding was that social expectations or social norms are very important to parents. They recognize that life is harder for their daughters, but they also want to uphold their role in their community and we call it here saving face. They want people to respect them and they don't want to be criticized about the way they are parenting. So the mother here says, she may not like the system of our society where boys are given priority for education, but she's saying, no, that's just the way it is here, and we need to follow the system. And another mother is saying, if any family has an unmarried daughter, people will say really bad things behind their backs. And the point is that they'll say the bad things about the children, but also about the parents, and the family will lose status. So combined with this is we're seeing girls becoming more advocates for themselves, and they're advocating not just with, primarily to start with within their family. So they're advocating with their parents and also their brothers as well, who are also advocating for the girls, you'll see. So here we see an example of a girl advocating for herself with her parents. Again, a father saying, my daughter fell in love with one boy and was trying to go with him, elope and marry with him. I told them to complete their education, and I talked to the boy as well. I told him if he studies well, when they grow up, we will celebrate your marriage ceremony. Both are studying now, and they passed their 10th grade examination. Another quote from a mother, things have changed a lot. My daughter told me not to marry her at a young age. She says she will study and marry only after completing her higher education. We have started believing that sons and daughters are equal. So that gives you a little glimpse into some of what the parents and the children are thinking about the changes. And I want to move on now and talk about the quantitative results. And just take one sip here. Okay, so now let's talk about the results of the survey. The first slide I have is really a snapshot of all of the results because they're a little complicated. So I want to give you one kind of framework in your mind, and then we'll go into each piece. So the first part of analysis that I'll share is on just choices. So what were the effects of choices? And to understand this, we're comparing all of the children and parents at baseline and all of the children and parents at inline, and not worrying about whether they're in the control or the experimental group because they all received choices. So with choices, we saw strong positive effects, just like we have previously, in all three areas of norms, attitudes, and behaviors. Some of the measures for parents were not very strong, so we don't always have results on parents for choices. So then on the right side, here we summarize the results of implementing the three programs together. So we saw, and this is taking into account that everyone received choices. So here we're really looking at what is the added effects of voices and promises. So we see positive effects on gender equitable education and gender equitable sharing of household chores. We don't see a positive effect. We see a negative effect, in fact, on girls' aspirations for the future. We don't see an effect in delaying marriage. And the supporting relationship piece is inconclusive. So that's all for the kids. For the parents, we don't see an effect on delaying marriage. So we can talk about this a little bit at the end about why we don't see an effect. I think there's a lot going on there. I think, for one thing, there's a lot of other programs in Nepal that are working on delaying marriage. So this program may not have had a lot of additive effect. Secondly, delaying marriage has a lot of other factors involved, sort of financial factors, educational factors, that are probably beyond a program that's just seeking to change norms. Because, it just is more complicated. It's not up to just the parents and the children so much there. Things like safety, availability of education, dowries, other kind of factors that matter there. Then for the parents, the measures were not very good, we can say. So our ability to assess the effects was a little bit limited, but you'll see we did see some positive effects, but we're not 100% sure on that, and more research is needed. So let's move on. So I think let me start just telling you a little bit about the sample, who we interviewed, who participated in the study. So you can see the control group on the left down here and the experimental group. So, a much smaller percentage because of the area that we work in were Muslim. The blue line represents Hindus and Buddhists. But you can see there was a significant difference between the control and the experimental group, with a higher percentage of Muslims in the experimental group, which is a challenge for the evaluation, because the Muslim groups tended to have, in some areas, more maybe conservative beliefs and attitudes and behaviors. So we have a little bit of a skewing here between the two groups. And then we interviewed more women, but we still had 40% of fathers. We also are not able to talk about differences between fathers and mothers because we did not have a large enough sample size. So when we talked about parents here, we're mixing mothers and fathers together. So the next slide shows us the children. So we had a really nice spread across the different age groups of the early adolescents. So we can see, pretty much equal segments between each of the ages we were looking at, 10 through 14. Almost all of the children were in school, 95%, and very few of them had started sort of the marriage process. Only 1.5% were married, 1% was engaged, and 2% were in the process of having their parents look for their husband to be. So, so let me move on now. And first, we're going to talk about the effect of choices on parents and adolescents. So remember, this is the entire sample, comparing baseline to inline. And the caveat here, or the concern here, is that we don't have a control group. So we're just comparing what happened at baseline, what happened at inline, and not comparing it to group that did not receive choices, as we did in the first evaluation. So here you see some of the key results from that analysis. You can see that the mean age that parents wanted to marry their daughter increased, that early adolescents disagree that it's more important for girls to help at home than to spend time studying, and they disagree that boys should have more free time than girls. So these are very positive results, and these results we controlled for other factors. So we are pretty confident in these results, and these are called odds ratios. So for example, you could say that children who participated in choices are 3 times more likely to disagree with the statement at the end than at the beginning. So that's some of our results from choices. Most of the strong and moderate quality indicators showed that their norms, attitudes, and behaviors became more equitable over time, looking at baseline and inline. So out of the 7 items or measures that we looked at, 5 were significantly improved, and the other two were marginally significant. So very strong results for choices. And you can see here, for example, that this one is a measure of a kind of sort of a game that we developed to look at gender roles, a card sort, that measured attitudes towards gender roles. And you can see that the boys and girls who participated in, at the end of participating in choices, they were over 4 times more likely to have more gender equitable attitudes, or to at least kind of express them to us. And they were 2 times more likely to have talked about their hopes for future with a sibling or a friend. And here we're showing boys and girls together because there were no differences between boys and girls, interestingly enough. So now let's move on to our primary research question, which is there a benefit of adding parent and community level intervention to the child-centered intervention, which was choices? So here we're going to actually be comparing the control group, which only received choices, with the experimental group, which received both. So let me take a little time here to explain this slide. So this slide is looking at parents, as you can see, and we're looking at delayed marriage for girls. So one of the areas or the domains that we're interested in looking at. We're comparing what we call the control group. So those are the people who only receive choices, versus the experimental group, or the study group, which is those who receive choices, voices, and promises. And then in this column, we're looking at what the effect was. And then here, you see the measure that we're looking at. So as I mentioned before, we did not see an effect on delayed marriage. So this slide is showing that there was not a significant effect of our program on these 2 elements. Okay, so moving to the next one. So here we're looking at the early adolescence on gender equitable education. So here we do see intervention effects. So we see that there's positive results in attitudes. So, they're more likely to say that it's important for a girl to help at home. It's more important for a girl, I'm sorry, let me say this again. They were more likely to disagree with this statement, that it's more important for girls to help at home than to study. So, 2 times of the children were 2 times more likely to disagree with this inequitable attitude. And they were 3 times more likely to tell their parents that, for the boys, this is boys only, for boys to tell it's for boys and girls, sorry. They were almost 3 times more likely to talk to their parents about the importance of themselves or their sisters studying. So very strong effect there. And that was one of the interesting results we also found in the qualitative, that the girls and their brothers were also working together to advocate with their parents for the girls' education and delayed marriage, etc. So this slide, now here we're still looking at early adolescence, and we're looking at household chores and resource sharing in the home. And here we see for 2 of these are first 2 are norms, and then there's an attitude. For 2 of these, the intervention had significant effects. So what this slide is saying is that the children who lived in communities where they participated in choices, and their families and community participated in voices and promises, had more equitable norms. They talked about more equitable norms in their community. So you can see this one. They disagreed with the finding or the norm that boys who help with chores are considered weak. So they were 3 times more likely to disagree with that if their family and community were engaged. And they were extremely 19 times more likely to talk about to agree with the statement that their parents admire boys who help sisters with their household chores. So this is similar to other research we found, that choices, voices, and promises has a very strong effect on sort of that family dynamic about how parents divide household chores and resources. It's important, sometimes people say, well, how important is that? You're only talking about the way boys and girls share household chores. But in reality, it's very important because it gives girls the opportunity to go to school. It gives them the opportunity to play, gives them the opportunity to have time to learn, to socialize, and imagine roles for themselves, beyond the household context that they and their mothers were likely brought up to do. So, so that's a strong finding. And then on this finding, and you can also see, for example, in this one, in those who only received choices, that's our control group, there was a little bit of a decrease here. But in the communities where the children who lived in communities which received all three, there was an increase from 81 to 96. So, quite a large increase. So here you see baseline inline in both groups, and then you see the intervention effect. And in terms of this attitude, there was not a significant attitude, although it did improve. So you can see children who received choices were more likely to disagree that boys should have more free time. So about 60 to 80%, big increase. And then here, there was also a big increase, 30 to 60%. But you don't see an intervention effect because the effect of choices was so strong here. So the additional inputs here didn't make a big difference in that case. So I know it's a little complex. It's quite a lot of data. We're trying to sort out, different measures, different levels. So this slide shows a few of the kind of key results here that are helpful to remember. So there was not an effect on on parents' beliefs around early marriage. So that was one of the areas that this intervention did not have a strong effect on. There was a very positive effect on the idea that it's important for girls to continue studying. So the odds ratio here is 3 times. So there are 3 girls and boys who achieved all elements of the program were 3 times more likely to have talked with their parents about this, so to advocate for themselves. And they were also 3 times more likely to disagree with this gender inequitable norm that boys who participate in household chores are considered weak. So you can see that's an interesting measure because we're really getting at that social desirability, the social expectation about norms. So one thing I'd like to mention, often people wonder, well, how did this vary? We had boys and girls, fathers and mothers of different ages and religions. So among the parents, there were no significant differences among parents, mothers and fathers. They had sort of the same kinds of responses, or older or younger. Excuse me. And there was none related to age at marriage. There was a lot of opposition to early marriage among both the Hindus and the Muslims, which is another reason why we may see that this program did not have a lot of effect. It was already 90 and 80%, so quite high already in this region. And then looking at the children, before the study, we often felt that assumed there would be differences by sex and also by age. But in this study, we found that to be a little bit true. Boys were more likely to express gender equitable results related to girls' education, and they were more likely than girls to talk with their parents about delaying marriage. And I think that's an interesting point because we think it has to do with the fact that boys have a little bit more power and social capital. So it's easier for them to break some of those rules. But we don't have proof for that. But that's my hypothesis. Girls had more gender equitable aspirations than boys, which I think is an important thing to note because what it's showing us is that boys are also trapped in what we call the man box. So boys also have social expectations which they feel they have to fulfill. So that's why this program works. One of the reasons why this program works with boys as well as girls. So there was some differences between boys and girls related to household chores, but they were not conclusive. So I think you can't really say anything about that. And then in general, even though we sometimes think that older adolescents have more rigid norms because they've been more enculturated into social expectations, we did not find that in this study. So no differences really between the younger cohort and the little bit older cohort, except that that older boys and girls were more likely to disagree with the norm that boys who help with chores are considered weak. So in that case, a little bit more gender equity among the older boys and girls. So how can we sort of summarize these learnings? So first, we see here that from this study and other studies that the program, the 3 elements of the program, were acceptable. Participants were excited about it. They were engaged in it. It was feasible to implement, and I think you can see that from the fact that we were able to implement it even in very difficult situations. After an earthquake, in the middle of strikes, gas shortages, we were still able to implement it, and many have gone on to implement it since. Even in a 3-month, very abbreviated format, where we did more sessions in a month than you would usually do, we still had good coverage. We reached a lot of boys and girls and parents, and we successfully reached fathers, which is unusual. So that's a very good finding. The research on how beneficial it is to add parent and community interventions is not conclusive. The results suggest that it was helpful in a number of areas, and it did enhance the results, but they're not definitive. Some of the insights is that, there's a lot of different influences going on in the community. So girls view their parents as support, but also their brothers. So it's interesting when you program for them to think about these different levels and channels of influence that children may have. They may have their aunts, their uncles, their teachers. So there's, different channels of influence that girls can tap into to increase their agency and achieve their goals. When you engage parents and brothers, it's important to do so thinking about their motivation and their needs, not just assuming they're going to get on board because it's good for their sister or it's good for their daughter. So I think the qualitative data showed that the parents in particular have stresses and influences working on them as well. So we need to think about, what is their motivation and what will help them, to do things that will then help their daughters. We found sequencing is important in choices, voices, and promises. Each module builds on another, so it's important to follow the sequence so that they can have the maximum effect. And then I had a finding about gender scales, which I talked about a little bit previously. So a little bit more high-level wrap-up. One of the things we learned from implementing this program is that what we call adaptive learning is really important. So that is when you take time as you're implementing a program to monitor, to gather data on who's participating, who's not participating, how they feel about the intervention, how the parents feel about it, analyze, think about that data, and make adaptations or changes in real time. So we had some challenges doing that with this program, and it was only 3 months long. So we didn't have a lot of time to do that, but at the end, when we went back and looked at the monitoring data, we did see really important findings. So certain child clubs were not implementing as planned. Certain districts had problems we think might have been due to supervision and training. So that adaptive learning throughout the implementation is really critical. So we still need more research to understand the value of working beyond the individual level. So not just with children, but with parents and communities. And the interventions, of course, need to be very carefully tailored to those social expectations related to your outcomes of interest. So this, I think, maybe is my last slide, and it's talking about, on this, it's really talking about what do we still have to learn. So we still are learning how parents and broader family members and caregivers in the community have impact on girls, who can really lead the change in these communities. Whether these changes will be sustained, we haven't assessed that. How to continue to support the kids as they grow older and they have different needs and, different social norms, constraining or facilitating their choices. And we're always looking at better ways to evaluate and assess interventions. So this is a quite old slide, but I like to show the slide because it does show the breadth of adaptations that have happened. So as you can see here, these are only some of them, but choices has been adapted and translated into many settings around the world. And then this is my last slide, and you can see here that we have the choices for the girls and boys, voices for the family, promises for the community, but then we were missing the fourth component of this suite of approaches, and that's it has been developed now. It's called commitments, and commitments is working to address to use these same influence principles, emotion-based principles for programming, to develop a program for teachers in primary schools. So commitments works with teachers to prevent corporal punishment, sexual harassment and abuse in primary schools, and also to increase gender equity, so less gender discrimination in terms of how teachers interact with boys and girls. So that consists of some workshops and then some interesting online like WhatsApp and Facebook groups to work with teachers to kind of shift their attitudes, norms, and teach them some new behaviors about how to discipline and support children. So that program is being evaluated just now, this month. So with that, I will stop sharing so that I can see you all, and it's probably time for a break.
Yep.
Is my guess? Yes.
Yeah. Thank you so much. Thank you so much, Rebecka, for your presentation. Excellent presentation, and thank you for leading us through this evaluation process. I think it's very important to see all the steps, the baseline, the intervention, and also the end line. All the qualitative and quantitative methods that you use, but also the qualitative result that you've achieved. So I think it's very inspiring for participants who are engaged in somehow in evaluation processes. So they will be able to be inspired by what you share with us. And also you talk about the challenges, the ongoing learning, and also how this method can be replicated, adapted to in other contexts. So I think thank you so much for sharing all this. So welcome back, everyone. I think we'll resume again. So we learned from Rebecka that we can combine academic discipline with grassroots activities, and this is it's wonderful. Now we have two questions on the chat box. The first one is from Aimé from DRC, Democratic Republic of the Congo, and he's saying that at the beginning of your presentation, Rebecka, I thank you first of all for your excellent presentation, and you said at the outset that the program is feasible. I know that it's not always easy to measure indicators, especially on the qualitative level. But sometimes you need a study or an investigation. Do you think that the change that you'll be able to observe with young boys doing housework can be can have any kind of incident within the community or the community as a whole, or needed to change social norms? I don't know if the question is clear enough, or you want me to repeat it again.
No, I think I understand it, and then we can counter back with another question.
Yes.
So I think there's two parts to that question that I think are important. One is will this kind of household level change or individual almost level change diffuse further through the community? And will this behavior change be sustained over time? So I think, so of course we don't know those answers because this was a cross-sectional study at, one very short point of time. They're good questions for research. I think that the idea of adding voices and promises was to diffuse change, throughout the community, to support behavior change and sustain it over time. Because it's true, I think maybe this is what you have in mind. One family, one sibling pair changing their behavior will not go anywhere unless there's other change in the community and broader social expectations change as well. So I think that's why I think it's important to work at those different levels, which is something that we did not assess in the study. We were just looking in the short term, were results better? The question should probably be, in the long term, are results better? That's probably the more relevant research question. And in terms of sustaining the change, I think that additional interventions are needed at different age groups. So those are appropriate gender equitable roles and attitudes for 10 to 14-year-olds. But when they're 15 to 18, or, there's different things they need to learn. How to communicate with their romantic partners, how to negotiate in couples, things about sex and family planning and work. So I think you would need other interventions to support these children as they go through other life transitions. The idea of this program is to start with children who are kind of coming out of early adolescence into older adolescence and still forming some of their gendered expectations around social roles. We have taken pieces of this program and implemented it in DRC, in Kinshasa, in a program called Growing Up Great. And we see similar, very strong results around the chores sharing and the gender equity around the household piece. So what remains to be learned is how do we build on that as the young people, get older, grow up.
Yeah.
I hope that answered the intention of your question.
Yeah, I hope that is the case with Emma. We have a second question, which is from Diego. Diego is member of the BC staff, which is the ethical process for working with the control group, because they will not receive all the benefits of the whole program.
Yeah, that's a very good question. So in this case, Save the Children had a very active child club program that, throughout the region. So the expectation was, and I actually don't know if this happened, was that once the program was tested, then it would be if it was shown effective and feasible and acceptable, it would then be integrated into their child club curriculum so that all of the child clubs, at least in the Terai and then possibly other regions, would receive this program. The other piece of that, so that's institutionally, that's what kind of the ethical piece on the organization side. There's also typically we do what's called stepwise. So you do the intervention in the experimental group first, or the study group, and then you repeat it afterwards with the control group. So that didn't happen in this case because of the situation and how tough it was. But that's typically the way it should be done. Your control group gets the intervention after this inline data is collected. I did see a question in there about which statistical program, from Diego also, I think. So I think most of the analysis was conducted in SPSS, but the analysis that I didn't present today, testing the measures, so the confirmatory factor analysis and all the analysis we did to see if the scales and the measures worked well. I think I didn't do that. My colleague did it. I think she did it in R. So we had to kind of use both of those programs. I can get this one. So he's asking, or she is asking, if cultural changes need, or saying cultural changes need time. How much time, did we have to form the groups prior to the evaluation? So again, I see two elements that are important in this question. So this program and some of the others that I've worked with Save the Children, like the one in Kinshasa, were developed for scale to be implemented in ongoing child clubs. So that's a program that Save the Children has in many countries, where they already have the child clubs established, and then we're kind of adding on new content, new programs, new activities for the child clubs to do, either peer facilitated, or by teachers when they're attached to schools. So in the case, for example, in Kinshasa, we understood there were child clubs, but when we went to start this program there, they really didn't exist. So they had to form new clubs. And that took, at least 6 to 8 months, maybe, that club formation process. And as that program has gone to scale and now been adopted by the government and the School Ministry of Education, they had to develop a special manual and process so that teachers could form the clubs. Because in the pilot, it was the NGO that was forming the clubs, but that's not scale sustainable. So then there's been a lot of work working with the Ministry of Education to develop a process by which teachers could form the clubs, and then these programs could be implemented. In this case, the clubs did already exist, so it made it much easier. So we were kind of reaching out to the club facilitators to run this program. And I don't know how long they had existed, but probably over some time. A couple of points there is that there is a lot of turnover, of course, because the clubs are peer led, and then the children graduate and move on. So the model here was to have graduated peer facilitators or child club members be the facilitators. So it was a little bit difficult. It was a little too difficult for the kids themselves to run the club. So the model was to look for, a little bit those who have already graduated from the program to be the peer facilitator. So I can't say exactly how many months, but by the time I got there, they were well established, and we were not worried about forming the clubs and such. Oh, and there's a good question. If there was a difference in results from the different countries. So sadly, I can't answer that question because partially I don't know how it went in those countries, and also I don't know if to what extent they were evaluated. So the only real kind of a little bit of a glimpse I have is what the adaptation that took place in Kinshasa that I was part of.
If you want to take the floor before asking your question, you can just put on your mic and then ask for the floor. You can use also some of the button that allows you to raise your hand, or you just can put on your mic and then your camera and ask your question. If not, I have a question. You said that the change happens when you engage the entire community, but we have some challenges if you want to associate parents. So how can you, address that challenge? At which level?
Which challenge are you asking about? How to engage the parents, or what was your? Yeah, so that is, I think, the most challenging part of this program, because as you all know very well, I'm sure parents are very busy, and especially fathers, and it can be hard to get them to meetings. So the first challenge, and maybe I have been misspeaking a little bit, is to make sure that we don't only talk about parents, but we talk about caregivers, because perhaps not as much in this Nepal setting, but I'm sure in many of the settings that you represent, it's not just the parents who are taking care of the children. It's the older siblings, it's the aunts, it's the grandmothers. So in DRC, for example, we really had to learn to talk about caregivers, not just parents, and to make sure that the videos, for example, were inclusive of grandparents and others who are taking care of the children. So they had to kind of change, make some videos that were specifically relevant to other kinds of caregivers. Also, in terms of engaging fathers, so we've tried a lot of different techniques there, different timings, doing sessions in the evenings and the weekends. I don't think we've had like a home run, as we say in the United States. We've had 100% success with that yet. So trying to understand what works for fathers, they are interested. It's not that they're not interested. It's just that there's some challenges in terms of labor migration and scheduling for the dads. The one thing that seems to help is, to do shorter sessions, to integrate them into spaces and times in which it's easier for parents to engage.
You just showed different stakeholders, that is children, parents, community. So the program is conceived not only for children and with children, but also with the families. And you said that there is a specific challenge when dealing with communities. So how is it possible to involve communities? What is made in order to have the community attending the different sessions? And I also want to know if at the institutional level there is something specific to be done. And are institutions also a challenge? So how to work with communities and institutions? Thanks.
So I think the key is what all of you know very well already. It's being an organization that is well rooted in the community and works hand in hand throughout the process. So it's true that working with the child clubs is in some ways the easiest piece, because either they're clubs that the NGO is already kind of forming and supporting, or you're working with the schools to do that. So that's kind of a very kind of obvious pathway. So the work with the parents is, definitely more challenging. So that can build off of the schools. So sometimes there's parent-teacher organizations that host that and kind of make that happen. They're typically not so strong, but that's one area. Or, just trying to build out from the children to their inviting their parents. The community level is, the process that Promises lays out is very sort of straightforward. So there's a process where you go into the community and you find places in the community where people gather, you find who are the influential people in the community, and you start with those small groups, and you post these billboards, or posters. So I think that's, that seems to be, we've also used that particular strategy in another program that we've worked on with Save the Children called the Real Fathers Program, which is a program to teach young fathers, to mentor young fathers to into their new roles. So fathers who have toddlers under the age of 3. And the object of that program is to prevent corporal punishment in the household and increase positive discipline and include and especially to reduce intimate partner violence. So the idea of Real Fathers is to break that intergenerational transfer of violence so that the kids aren't seeing it in the household. So that program is very much focused on mentorship, but after it was piloted, there was sort of the sense that there was not enough community engagement in it, and the fathers couldn't change while the community members were looking at them and making fun of their wives because the fathers were helping with the chores, so that there needed to be more community engagement, but there was very little, they needed something kind of light, something that they could do easily. So we borrowed the Promises piece of Voices and Promises, and the billboards, the big community posters, and we did those. That was in Uganda, and it was very feasible to do. So, folks would see, they would do, it's the key is getting the messages right. Local pictures and emotion-based messages that the community then can respond to. Having people gather around those posters, unveiling them, talking about them, and then signing a pledge to support change. So those are all things that are part of good social norms transformation programs, where you're diffusing throughout the broader community beyond those individuals you want to change. So it's not just working with the parents and the children, but those around the parents and the children who can influence their behavior. You're diffusing, through those posters, and you're having people come together to do public testimonies and pledges to support change. So I think that element of this program is actually quite feasible to implement, as long as you have, some folks working in the community that can make it happen. I don't know that I have additional insights, but I might ask participants, all of you, where you see this would be sort of relevant in your settings and where you see challenges. Because I think one of the very interesting things about this program is how it has been and can be adapted, and in new settings. I've talked about a few examples of where we've taken pieces of these and adapted them. So I guess maybe that's a question to you all, where you see it resonating and relevant, and where you see it not very appropriate. And it would be interesting to talk a little bit about what adaptations might be needed. So one of the things, I work, and I can talk a little bit about this, I work a lot on adaptation and scale. And just most recently, I don't know if you all are aware of the INSPIRE strategy. Okay, so yeah. I see some heads nodding. So, as you know, INSPIRE is a set of strategies for, addressing and ending violence against children. And one of the pillars is social norms programs. So the programs I've been talking about here with Real Fathers and Choices, Voices, and Promises are strategies mentioned in INSPIRE. And we got to the point, or the INSPIRE working group, they got to the point where the question was, this is great, but how do you spread it? How do you adapt it? How do you scale it? So I worked with a colleague of mine, whose name is Joseph Petralia. We worked together for INSPIRE to develop an adaptation and scale up guidance for the pathfinding countries in the INSPIRE working group. So it has a series of, and it will be out, actually it's on their website already now, but it's still undergoing some changes. But it provides organizations like yours and governments sort of a pathway to think about how to form a resource team or a group that's interested in supporting scale up, how to select interventions that are effective and scalable, how to adapt them for the new setting, how to monitor and evaluate scale up, and learn lessons from that. So, and how to manage them adaptively. So that will be a good resource, I think, for all of you. But one of the very interesting pieces of that is looking at the idea of adaptation. So we used to say that you wanted, when you scaled up a proven practice, you wanted to be faithful to the practice. You wanted to, implement exactly the way it was tested. But we no longer believe that, because we know that contexts are always changing, with different settings, with new populations. So we know we have to we talk about fidelity to the outcome. So we want to make sure that the program is still effective. And in order to do that, you're going to have to adapt, but you need to understand the core principles of the program. So what is it in the program that makes the change work, right? So, I think we're all doing a better job these days of documenting that in our programs. This program was done, quite a while ago, and I don't think we did as strong a work as we should have in terms of what is core to make it work. I mean, I'm sure Brad spoke with you a little bit about that. I think the emotion-based programming is probably the influence principles that he shared. That's probably the core that you would not want to change. We also, I don't know if this is still the case as it's evolved, the peer facilitation was considered a core pieces of choices. I think in this expanded version, you would say engaging the community and engaging parents are also core principles. But there are things that can be adapted, if you keep in mind what are those core principles. So I guess that's a long way of asking a question, which is, what do you see as feasible and relevant from this approach, and what do you think be as a challenge? Because it might be interesting to chat a little bit about adaptation.
Yeah. So you have a question. How this is relevant? How can you adapt challenges that you might face or you are facing in terms of changing, working towards the social norm change, and how to make sure that you attain results and sustainable results in the community. So this is the question that Rebecka put forward. Yeah, I think the question, the main challenge is how to make sure that something that exists within the community for centuries, for many years, how can you address that within your program? Maybe 1 year program, 2 years program, or 3 year program. So how can you change that social norms, behavior in such a short period of time? And I think it's a challenge, even if you engage with all the stakeholders, parents, peers, caregivers, and all those constituencies within the community. You still have that challenge, how to address all those thinking, behavior that we've been going through many years, decades. So this is it's key. And now when you you set up a program to address this, then you can face some challenges. Those who are not in favor, those who are in favor but fear that change might change the power relationship. And this is also something that we've seen in our communities, and it's very challenging.
I'm going to share a resource with you. We have a comment from Gaston. Change is possible, but not in a short time, I think is what that says. And yeah, that is true. So I just put in the chat box a link to the Align platform. I don't know how many of you are familiar with Align, but it's a really great resource. It's run by the Overseas Development Institute in the UK, and it is a platform for gender resources. It has a lot of great materials. And another resource that you may or may not be aware of is an initiative that I'm involved with called the Learning Collaborative on Social Norms. So the learning, I've just actually, I could probably even go there and show it to you. So let me see if I can do that. So this is a network of organizations interested in social norms programming. And yeah, so I'm sharing it now. Yeah. So here you can see the Social Norms Learning Collaborative. So it's jointly funded by USAID, the Gates Foundation, the Hewlett Foundation. And it's there's 5 communities. So you can see Nigeria, East Africa, South Asia, Francophone Africa, and a global group who is interested just in change around the world. And you can join them by clicking here. You can see here, for example, a map of, you can search here, put in a particular country, search here, and find different projects on social norms. And you'll also find some of them will have instruments, resources, like you can see here. So there's a lot of really great materials. And let me see. Let me go back up. This is a new website, so I'm trying to find where the resources are. Oh, I guess they're here. Okay. Yeah, so you can find a lot of great resources on social norms here. Yeah, I'm not finding them right now, but in any event, I suggest if you're interested, I just put it in the chat box, and you can go there, and there's materials on called the Social Norms Exploration Tool, and how to address social norms, how to diagnose them. We call it, like how to do. It's about participatory resources on social norms, on participatory resources for doing. Participatory research approaches for diagnosing, so to speak, and assessing social norms in the community. There's a new tool called Getting Practical, which is how to take that information and design social norms programs. There's a new, it's called the Social Norms Atlas, which presents different social norms across 10 different sectors, from education to technology. So you can kind of get the differences between what's an attitude versus what's a norm. There's case studies and references of materials about how to address norms in that sector. So it might be a good resource for you all. And then I see we have, and one of specifically one of the, there's also a tool in there on measuring social norms, which might be useful. And then the tool on programming for social norms addresses this question about length of time, and trying to get people and donors and programs to understand that you may not be able to change norms in a program time frame. Certainly not within 2 years, possibly within 5 years, but definitely changing social norms takes more time. And we just put out, and it's on that website, also a new material which is about adaptive management. So it talks about how do you measure shifts in norms, or monitor, better spoken, how do you monitor shifts in norms in a program to know whether things are going in the direction you like, and whether there's negative consequences, unintended consequences, or social pushback to your program. We built a lot on the work of CARE with that resource, and it has some very practical tools on monitoring social norm shifts.
It's a comment from Gaston, who said that change is possible, but it takes time.
Okay.
And said that I think we need to be patient and associate all the community-based actors, and sometimes the state, the government as well.
Yeah. So that's another really important reflection. And, often I get, from the research point of view, excuse me, donors also often ask me to do sort of a particular kind of research, like, let's just work with the kids and not the parents, But sometimes, and Save the Children is a good example, they just say, why would we do that? It's not ethical, it's not feasible, it's not going to work, so we don't want to do that research, right? So I think it is, it's okay to say, change takes all these different elements, and it can't always be parsed down to a very neat research study, and we also can't always measure everything we want to measure. So as the implementers and the change agents with the communities you work with, you know what is needed to bring about that kind of change. So, it is complex. It can't be, there's no silver bullets for one magic program that's going to bring about change in 1 year. So I think that's a good thing to remember. And also your comment about working with the government and the state is a good one. So definitely very important for reaching sustained and widespread change. But there is also, when you work with Scale Up, there's a lot of pressure to work with the government, but there's some counter pressure also. So if you remember, this kind of program is about social change and about achieving gender equity, and some of the state actors are very involved in maintaining that status quo. So not that you shouldn't include the state and work with them, but they're not always the only or the best actor to do that. So think about civil society, feminist organizations, women's groups, other groups that can also need to lead change and be a part of that process without leaving behind the state, of course. Thank you, Diego, for putting the Align platform in there. And yeah, no other questions, just comments. You might be interested also in another research, which is called CUSP. Let's see, I'm typing it in here, but I can send the link later. It's the Community to Understand Scale-Up Practice. You can also Google it. It's sort of run by Raising Voices, which is a non-governmental organization in Uganda that does work about violence against women. But they've brought together a group of about 10 organizations that are working around scaling up interventions that are designed to achieve gender equity. And we've done a lot of thinking about like ethical scale up and some of the issues, both about research, but also about program implementation that should be considered. And so some of them are like, you may have heard about SASA, which is a very well-known violence prevention program, or Stepping Stones. So those are the interventions that the CUSP group, example of the interventions CUSP is thinking about. And there's been a lot of pressure to scale those up widely from donors. But there are also considerations about how to do that ethically, how to maintain fidelity to the model, how to reach more vulnerable populations. So there's a lot of interesting questions around scale up that you might be interested in by reading some of the CUSP work.
If we don't have any question, maybe we can go to the concluding observations, the concluding remarks.
Is that from me?
Yeah, yeah.
Okay, so I guess I would just first thank you all for spending so much time with me. It's been a pleasure, and I think I've been making some of the concluding remarks already in this session. So, think about when you're implementing programs like this. Think about what's scalable and sustainable, because what we're trying to achieve is norm change at a broad enough level that we can really reach what we call the tipping point. So enough people are changing and enough people see people changing so that expectations of what is normal starts to change. So it's very important to think about not only what programs are effective, but what programs can be implemented and sustained in your settings at a scale by which you can bring about that change. Because, we're no longer really interested, I think, in having these kind of, I call them boutique programs that are really effective for 10 villages. We're really trying to think about what kind of approaches can be rolled out to have a broader change, because unless we really address these underlying gender norms, we're going to have difficulty fulfilling our objectives across all of the domains that we talked about: education, health, child marriage, safety, violence. So we really need to think in that way. And that does require programming across the ecological system, not just with those individuals we want to change their behavior. We need to also work with their reference group, those who teach them and enforce the social norms, and might have more power over the way they actually behave, as well as the broader community. So that's really the intention of Choices, Voices, and Promises, to work at those different layers to support, abilities of communities to reach that tipping point. I think that's pretty good. I think the resources I shared should be helpful, and of course, I'm always happy to talk one-on-one or share additional resources or point you in the right direction if you have other questions.
Thank you so much. And on behalf of all the participants, I would like to sincerely thank you for your time, for all the material that you share with us, your presentation. And I think it's very important to work on social norms, on norms, attitude, behavior. And I think even if it takes time, we have to start somewhere. So let's start. Let's be, work hard to change those social norms that are not in accordance with what we want to achieve together as a shared objective. So thank you so much. Thank you. Thank you, Rebecka.
Thank you so much. Thanks for the opportunity.
Thank you for your time. Yeah.
Take care, everybody. Bye-bye.
Merci beaucoup à tout le monde et à la prochaine.